Okay, hi Ali, hi Bryan. We're going to be talking about shielding today. So I'm Rob Burley, I'm Director of Campaigns, Care and Support at Muscular Dystrophy UK. Bryan, do you mind introducing yourself first?
Yeah, well, thank you for this opportunity. I'm Bryan Gould. I have a late onset rare muscular dystrophy called ocular pharyngeal. Diagnosed at the age of 47, I'm now 60. And the implications for me with COVID is that associated with the condition is dysphagia, difficulty swallowing, and the possibility of aspiration. So I've got a weak cough reflex, and so all of those add to the mix of having respiratory complications should I get COVID.
Thanks, Bryan. And Ali, how about you?
Yeah, my name's Ali Kay, and I have a little boy called Bertie who's just turned 9, and he has a collagen 6 related disorder, which is a rare form of congenital muscular dystrophy, and he has reduced lung function. We call it reduced forced vital capacity as a result of that, and it's actually below 40% when he's lying down, and under 60 when he's sitting. So COVID presents problems not in that he's more likely to catch it, but that if he does catch it, he could face considerable complications. So, yeah, it's been a worrying time.
Yeah, and shielding's definitely been on the forefront of people's minds for a long period now, but certainly in the last couple of weeks since the government announced that, well, effectively from the 1st of August, shielding will, as we know it, will come to an end. So really interested to hear from you both. Bryan, first, perhaps, what has your experience of shielding been so far, and how did you feel when you saw the announcement about the 1st of August relaxation?
Well, I describe shielding as being a slow roller coaster. It's a slow roller coaster of emotions, principally for myself and my wife. My wife has MS, so she's also taking extreme caution because of the immunosuppressant drug that she has to take. But it has been a roller coaster. It's been mentally a challenge. There's been highs and real lows associated with watching the world go by, principally, and not being able to hug and see my sons and their partners and family, of course, or the family and friends, and just our whole existence has been locked down. Lockdown literally from the week that the government initiated lockdown. We were frantically trying to complete a house build to make it disabled friendly for me, wet room and bedroom, etc. So we were really stressed and anxious that with the coming and going of different trades, that we needed to lock down as quickly as possible. So from the 26th of March, I've been in lockdown. But then there was a quiet. There was no information coming out as to whether I was on the extreme vulnerable list, how clinically vulnerable I was, and what that would mean in terms of shielding. And I had to push the issue, to be frank. I went on the MDUK website, saw the guidance that the charity provided, and registered on the government website to see if principally we could get access to online food shopping, so that we weren't putting our family at risk of going out and doing the shopping for us. And then again, no information, nothing coming back. And then on the 8th of, was it the 8th of April? Yeah, the 8th of April, supermarkets contacted us via email and said, Mr. Gould, the government has told us you are extremely vulnerable and therefore you qualify for priority food shopping. And then it was the end of April before I heard officially that I was on the extreme vulnerable list. 24th of April from NHS, and the same week from my consultant. So we had decided to isolate and shield, but we just felt that, you know, the information was very sketchy and very difficult to comprehend. And then later, of course, we had the announcement out of the blue that we could go out and get a 1 hour's exercise or one amount of daily exercise a day. No guidance from clinicians, no input from the healthcare sector. So we thought, okay, well, we'll venture out, as I did on VE day, onto the front drive and pass the time of day with the neighbours. But other than that, I've been in the street once in my wheelchair and in a couple of private spaces just to get some fresh air. But other than that, you know, it's been really difficult emotionally. So this latest view on further easing of our lockdown comes with some reservation about, well, has there been scientific evidence to support that? And what does that mean for me going forward and my wife? What risks are associated with travelling outdoors once more? So yeah, it's patchy and still a concern.
And Ali, how about you? What's your experience been of shielding so far? And how are you feeling about the sort of the announcement regarding 1st of August?
Yeah, gosh, I could relate to so much that Bryan was saying there. I mean, we also initiated slightly earlier than the official lockdown, having had several phone calls from Bertie's hospital team. I think we've been through several stages, so I could relate to the roller coaster analogy very much, because initially we were we were on a mission, we were very stoic, we stocked up, and you know, friends were extremely helpful in that phase as well. It was an uncertain time, because I agree with Bryan that there were delays in the messaging, and I think we felt we had to use our initiative quite a lot. We sought some clarity from Muscular Dystrophy UK. We were talking to other people that we knew in the community with children with similar conditions as well. Over time, what I noticed was, you know, with the best will in the world, friends become tired of helping a lot. We were cut off from our family, and so we didn't have the support network really that we needed. Bertie requires, you know, care, because he's semi-ambulant and he does need help with, you know, getting in and out of bed. He has a special hydraulic chair for the bath, an electric bed. He has a walking frame and a wheelchair, and he needs a lot of assistance with things, and his upper body is weaker. So it's really quite a full-time caring role. The children were out of school, and this presented additional issues for us, because we were juggling work and studying and other commitments with 3 children at home who all needed different types of assistance, initially just to get used to remote learning, but also the psychological effects of being at home and cut off from their friends and their grandparents for a long time. And then Bertie would have a one-to-one assistant in school, partly for caring needs, and partly for just sort of support accessing technology and things like that, scribing. So when he's learning at home, he still needs that one-to-one assistant, and over a long period of time, I think this has been one of the biggest challenges for us, to juggle that around work and other things. We haven't been able to go out very much at all, partly because we live in a coastal seaside town, and as soon as the sun comes out, the beach is flooded, the promenade is flooded, the parks are flooded with people, and we've even found small things like trying to go around the block with his wheelchair, other people not crossing the road or getting out of the way, and if you've got to navigate the curbs where there's no drop curbs or there's parked cars, that's an extra issue. So it has been quite limiting. And I've been really conscious this whole time that we are just incredibly lucky that we have a garden. And there've been times in our life when we've lived in places where we didn't have a garden, and if we'd still been living in those properties, this would have been an entirely different experience. So I really just want to speak up to that, because it's one of the things I think I felt most worried about other people in our community, that it's just taken for granted that people can have some fresh air and outside space, but not everyone has been able to do that. And 3 or 4 months of not being able to do that is hugely psychologically draining. Mm-hmm. I'd just like to say something as well about the siblings of children that are shielding, because again, they began very stoically and definitely have had a dip in the middle, missing friends. I have a daughter who's in year 6 who couldn't go back to school, and so feels a bit more left out. A teenager who's okay with things. He's a very independent learner anyway, and his cohort aren't back in school anyway, so he's running along the same. But my daughter particularly has found it hard. And often the guidance that the government has issued has not particularly recognised the needs of siblings. And I think the new guidance, in some ways, it brings relief, because everyone needs hope and everyone needs to feel like things are going to become more manageable. Thank goodness that bit of the roller coaster is over. You know, we can, but like Bryan says, we also want to know that it's based on something. And I think that side of things hasn't been entirely convincing. I personally think too much responsibility is going to be put on the individual.
Yeah.
So I'm nervous about this phase now, I think.
I think that's a really interesting point, Ali. And what's been interesting for me over the past 2-3 weeks, the government really have been emphasising that shielding is about individual choice and an individual assessment of risk. And I agree, kind of that seems to be placing the onus a lot on the individual. They have talked about the role of clinicians in making that judgment, and you've both mentioned the discussions you've had with clinical teams. So just wondering, you know, as we move towards the 1st of August, what kind of information would you want, and who would you want that discussion with? I was speaking to some care advisors last week who sort of felt very much that it had to be the consultant who led those discussions, and it'd be interested to hear your perspective and kind of who you would be comfortable hearing information from, and what level of information you'd like to make that decision about your approach sort of beyond the 1st of August. Bryan, I don't know if you want to go first.
Well, yeah, I mean, it's a difficult one, because I think those with muscular dystrophies and rare conditions such as ourselves, we see a raft of different clinicians, and it's very much a multidisciplinary team approach in terms of our care and the consultations we have. I think it does need to be somebody putting it together, so that in this case it would be, for me, my consultant neurologist who's expert in neuromuscular conditions, and taking guidance from the other aspects of the MDT that look out for me, so to speak. And I think up to now there's been this view, perception, and I think the reality has been that the government has taken these steps without really engaging with clinicians from the different conditions that are classed as extreme vulnerable. And so I would like to see my consultant really having a view on what it would mean for my isolation easing, if you like, in conjunction with the scientific and medical research that the government has available to it. So really, I think it is a consultant neurologist, somebody that knows me, knows my condition, knows my fears and needs, and has a view on the condition as it presents.
Yeah, Ali, how about you? Yeah, I think Bryan's really hit the nail on the head there by saying it's someone that knows you, because every condition is can be slightly differently experienced in the individual. People can be at different stages in their journey, and what can be sometimes a description of where someone's at with their condition on paper might be just slightly different in their lived experience. and everything has to be balanced. It's a benefit risk assessment for people's psychological well-being as well as what's practical. I think for us, I mean, I actually had a conversation yesterday with Bertie's hospital-based physiotherapist, and I think the respiratory physio team is really key if the reason you're shielding is reduced forced vital capacity or any other sort of respiratory led issue. They are extremely knowledgeable, and if you're already in the system with them, they will know sort of where you're at. I think where there are perhaps challenges is that because these are conditions that are progressive, sometimes people can be at quite awkward junctions. So I know, like Bertie, for example, a week before all this happened, had new measurements taken for his forced vital capacity. Things had reduced significantly, must initiate a full sleep study to make sure that he's breathing correctly in the night. And of course, that hasn't been able to happen because of lockdown. So that added to our stress and worry during this time. We've had another conversation about it yesterday, feel a bit more reassured. So it's really important to keep those appointments going, even if it's just on the telephone. And what was really valuable to us was the clinicians saying, you know, phone anytime. If you think there's a change, phone. We can do it. It's complicated to carry out these tests at this time, but we can do it. But the benefit risk means, you know, we'll hold off if we can for a while, but, you know, don't sort of suffer in silence and worry in silence. Keep that conversation going. And that was really reassuring, because it was quite frightening to be told, your son's entered this really worrying zone, this needs to happen, but it's not going to happen. I think there's many families out there and individuals that can relate to this. I know of other families that were also, you know, on the cusp of having some sort of test or therapy or treatment, and that hasn't happened. So I think factoring that element into the changes in shielding as well, it's always a balance, isn't it? Trying to juggle those different needs.
And I think for Muscular Dystrophy UK, sort of beyond, well beyond this phase, I think actually our focus for us is going to be liaising with services on what do they need to be able to deal with the backlog of appointments that have been missed, and discussions with people that don't relate to coronavirus at all. And I think certainly again, going back to the discussion I had with care advisors last week, a comment there was that, you know, actually the clinical impact of coronavirus on people with a muscle wasting condition is likely to be nothing to do with coronavirus, but more about what's happened in this period where they haven't had access to the normal range of support. So certainly a priority for us to sort of take forward. And Ali, you mentioned living in a seaside town and the behaviour of other people. I think certainly a lot of people have been contacting us around that being their worry. But, you know, if they do decide to sort of come out more beyond the 1st of August, how will other people give them space, etc. And one idea that has been discussed by a group of charities that we've been talking to alongside some government officials in a series of workshops. But interestingly, people have started to raise with us independently is perhaps a lanyard or a badge that people could wear to highlight that they're still vulnerable, and could people give them space? I don't know how both of you would feel about that. Ali, you mentioned behaviour in your towns. How is that an idea that appeals to you, think, or something that could work to help people just understand that you and your family may need a bit more space when you're queuing for something or out and about again?
Yeah, we've discussed this very much in our household, and I have to say that we all have slightly different opinions on it. So my son thinks it wouldn't help very much, because he thinks people wouldn't really notice it enough. You know, if you're in a busy environment and people are not really focused on you because they're doing their own thing, they'll be quite close to you before they've noticed a badge or a lanyard even, because lots of people wear lanyards for lots of different reasons. So you would need a sort of national scheme, really, something very recognisable. I think I could see its uses, though, in other settings myself. If it's not too busy an environment, so perhaps you're in a shop, a supermarket, and you're trying to navigate the aisles, people might notice it a bit more in that environment, or perhaps queuing for tills and things. It might help, I think, because it's completely not practical to have one set of people trying to observe 2 meters and another set of people working to 1 meter and actually frequently no distance at all. it's not doable. And I think it's very unreasonable for the government to place that burden of responsibility on the individual, who are, by the way, the same individuals who've been repeatedly told that they're the ones that really need to worry throughout this entire period. They've been used as a sort of comfort blanket to make the general population feel better. Don't worry, it's only the clinically vulnerable that are more susceptible. So this group potentially, I'm not going to use a blanket statement, but potentially can be feeling really anxious and nervous. Now having to go out into these environments. Badges and lanyards could work in some environments, should definitely be down to choice. But I can see it also not working in some environments as well. So I'm sorry, that's a bit of a on the fence, isn't it? But
well, I think you're absolutely right. I think it would need to be, it's about public education of what it means as well. I think you're absolutely right. Your son's right about how close you get to someone before they see a lanyard. Yeah. Bryan, how would you feel about that kind of idea?
I can relate entirely with what Ali's just said. I can see the benefits of it, and also I can see that in many environments, that visibility of that lanyard or that badge would not be seen and witnessed. My concern at the moment is, of course, with the easing of lockdown and what we've seen, is distancing measures seem to be a bit of a free-for-all, to be frank, and that's a real concern. We keep being told that in outdoor spaces there is less risk, but of course what we see now is recreational activities and the sheer volume of people in those outdoor spaces increasing with little or no social distancing, let alone what the status might be indoors. So I think, I go along with Ali, I think for this to work, it would need a government push, some publicity promoted by the government and obviously endorsed by the charities. And personally, I would wear the lanyard. I would carry that visibility with me. I would see it as the right of the individual not to have to do that, because some people would feel uncomfortable. We with disabilities often feel as though we're putting ourselves out there, and we want to be seen as a normal part of everyday life, rather than promoting our disability, so to speak. So I think it would be the right of the individual. I think without good publicity, an active campaign from the government, supported by the individual charities, then it would fail. But I would support it if that publicity was in place.
Great. And an area that people have certainly been raising with us of particular concern is how their employer might view the end of shielding from the 1st of August, and particularly linked to that idea that if you've taken your own risk assessment and you feel you should remain in shielding. I'd just be interested to hear, you mentioned that juggle, Ali, of kind of homeschooling, work and caring. I could certainly relate to two of those factors as I look nervously at the door next to me. So yeah, how what's your experience been with your employer, and how are you sort of feeling about that kind of how they might react beyond the 1st of August to the fact that you might want to stay in isolation a bit longer?
Yeah, well, I've been very fortunate in my own circumstances, but I recognise that is not everyone else's circumstances. But I'm training to be a genetic counsellor, and that's a job within the NHS. So I think there's already lots of protocols and awarenesses that were helpful to me. They weren't necessarily set up for me, but they ended up being helpful. So a lot of our service has been remotely delivered or delivered by telephone at the moment. So it was much more possible to talk about working remotely. But also because I'm extranumerary, because I'm effectively a student genetic counsellor, I think it's much easier for the service to be flexible. And perhaps if I was, a lead genetic counsellor, that would be much more problematic. So I can see this not playing out quite the same for everyone. So again, it's one of those areas where you can't sort of give a one-size-fits-all solution or answer. Obviously, the university played a role as well, because they're part of the qualifying body for my training route. And I have to say, actually, that the university were a step ahead the whole way through this process. It was Cardiff University, already rethinking how a clinical placement's going to work and giving us a very clear message that no student was going to be disadvantaged. And that was really early on that they started making those sorts of noises. And it was really reassuring. So I can say what a big difference it does make if your employer or education organisation gets behind you and has a good policy on this. And conversely, if the reverse had happened, it would have been devastating. And I think I would have had to at least temporarily have dropped out of my training. Absolutely. You know, for several months there, it was just not possible to do everything. Now doing things in a very part-time, fit around other things capacity, trying to ramp up to building it into a more regular working pattern. But, you know, it's an ongoing dialogue. But I'm so grateful for the people that have, you know, not isolated me during this and seen me as still being valuable. Yeah. I
think employment will continue to be a major theme of those workshops I mentioned that MDUK is part of, sort of these cross-government workshops. And today we've just signed up to a call for potentially using the furlough scheme a bit more flexibly for people who wish to continue shielding, which I think could be quite important. Those workshops are continuing over the next sort of few weeks with a view to charities being involved in feeding into the guidance that will be produced for people from the 1st of August. So sort of final question for you both. I'll start with you, Bryan. If there was one thing that you think needs to be included in that guidance and the MDUK should be sort of pushing for, what would you look to from that guidance from the 1st of August?
Wow.
You can have more than one.
Okay, well, I mean, it's a difficult one because it's a moving feast, and who's to say where we'll be in 3 months' time. I guess what needs to feed into such a workshop or engagement with the government would be things around a whole raft of things, to be honest. How often the extremely vulnerable who are to remain on a shielded list, how often and how frequently will that shielded list be reviewed? And what would be the criteria for reviewing that list? The scientific, the medical input into why that list, or rather the implications for people such as ourselves, how the decisions will be made. I would expect that, as we said earlier, that there would be good clinical input into those discussions. There's other things, you know, DWP, Department of Work and Pensions, those with disabilities, the need for there to be some flexibility around the procedures associated with, you know, PIP and disability living allowance and the measures put in place to be more flexible in terms of the process itself. Look, we're fast approaching autumn, or will be. So the autumn-winter considerations, the access to healthcare for people who are extremely vulnerable. I mean, you know, we're still hearing that dentists, you can't go and see a dentist. Well, as and when dentists are able to see people, there needs to be a priority associated with those who are extremely vulnerable or on that list. So I think we need some priority access to healthcare provision. So I guess there's so many things that would feed into that discussion.
Thanks, Bryan. Just a short list for me to take into those workshops. Thank you. Ali, I'm conscious that I've yet to upgrade my Zoom account, so as I watch the clock tick to 2.5 minutes to go,
I'll be quick then, Rob.
Yeah. Anything to add to Bryan? So
yeah, well, I think, as ever, Bryan hits the nail on the head again, that it's about priority access and coming up with a hit list of what that priority access is for. If you're going to place all this responsibility on individuals that already have plenty of other things to deal with, you have to do something to empower them to make that possible. Do we have priority hours in parks? or very busy public places. No, we don't. And yet we know that they are successful in other places. Do we really need to revisit this issue of face masks? Because that would actually make a lot of people feel a lot safer in environments where they are simply not empowered to ensure that social distancing is working. And, you know, lots of people are working and juggling education. So making sure that the needs of the shielded child in education who might have, who might receive intimate care in their education setting, making sure that's been thought about, because it clearly hasn't yet. And making sure that people are listened to and talked to, and that it's not just delivered without that having happened first. So I've tried to get that in fast, Rob.
Thank you. So thank you so much for your time, Bryan and Ali. It's been great to catch up with you this morning. And yeah, some fascinating insight and thoughts. I think something that's really struck out for me is that the challenge of individual responsibility being sort of played up. And Ali, something you said around extremely vulnerable people being used as a comfort blanket for the general population. I think that's a really sort of powerful way of putting it. I think I agree. Kind of think there's been a lot of, you know, oh, don't worry, there's only a small number of people who are at risk. So thank you so much. We'll take forward those conversations in those workshops. But yeah, thank you so much. I'll sign off now. Thank you.
Thank you very much. Thank you.